Well, hello to everybody here. It's Teresa Sanderson. Oh my gosh, as always, I'm so excited to connect with you. We have a wonderful guest with us today, Dr. Julie Siemers. So, Julie, thank you so much for taking time to join me today for this interview.
Thank you for having me. I'm happy to be
Of
here.
Of course, of course. So, for those of you who don't yet know Dr. Julie Siemers, just know that she brings more than 40 years of invaluable healthcare experience to her mission of saving patient lives. With a profound commitment to patient safety, she utilizes her extensive nursing background and education to transform healthcare culture. To tackle preventable patient harm, the third leading cause of death, she authored the book Surviving Your Hospital Stay to empower patients and families. Through her speaking engagements and consulting work, Dr. Julie Siemers strives to educate others, reduce medical errors, and enhance healthcare safety. Oh my gosh. In today's healthcare world, this is so vitally important. So thank you again, Julie, for joining us today.
You bet.
Now, I know that I know and understand the work you're doing today. My audience, though, of nurses and nurse entrepreneurs are typically very curious about what is your background in nursing? How did you get started and what kind of environments have you worked in? Tell us a little about that.
Yeah, I think that is a great question because it does play into where I am today.
Mhm.
So when I was a teenager, my mom suggested, "Hey, Julie, why don't you go to nursing school?" Because she'd always wanted to be a nurse. So I said, "Yeah, that's a really great idea." And I applied. I got out of high school a year early, got into the community college, and started in many, many years ago, it seems like, but I still remember those days. And I just worked on the med surge floor for, gosh, 10 years, oncology and a step down cardiac unit. And then I went into the ICU. And then I went into the ER and the trauma center. And then I spent 10 years as a flight nurse on the helicopter, which was
Wow.
amazing. There's so many times I said, I can't believe they pay me to do this job. This was in Las Vegas.
Oh,
And I
wow.
remember flying over on New Year's Eve, the Las Vegas Strip, amongst the fireworks, as we were heading back to the base and thinking, wow, I never would have dreamed I'd be there doing that. But yeah, and then I transitioned into nursing education in 2009. And that's
Okay.
when I started working on my master's degree because I wanted to teach in the classroom. And my master's thesis that I chose was patient safety
Ah,
and
okay.
failure to rescue. And I was surprised that a lot of nurse educators didn't even understand the terminology of failure to rescue and what is it, because it's not in the nursing curriculum.
Mhm. Wow. Wow. That's crazy. Okay. So, you started out, you worked in a variety of places, and then you moved into education and getting your master's drove you to this piece. And so then what drew you into the world of entrepreneurship? How did you make that transition from, being someone's employee and kind of doing this work and learning to stepping out on your own?
Yeah, I continued the journey and got my doctoral degree so I could do this practice-based project again, and wondering why it wasn't in the nursing curriculum. And I thought it was a big gap. But I also noticed, being a nursing instructor with students in the hospital, that there's so many family members that have no idea what's going on. They don't know what questions to ask. They don't know how to use their voice,
Mm-hmm.
or even choose a safe hospital. And in my research, I'd learned all these things. So I decided to write a book for patients and their families. And then
Wow.
after that, I thought, okay, now what's the next step that I can do? And that's when I knew, being a part of nursing education, that even though we do a really good job, or we think we do, we hope we do in school teaching,
Yeah.
that there's still nurses that graduate that have so many gaps in being able to keep patients safe. There's a couple studies that were done, one in 2006, same study done in 2016, and then in 2021. And this was a 5-hour exam that measured not only written, but the application, like in the simulation lab, of
Mm-hmm.
these newly graduated and licensed nurses to assess practice readiness, safety, competency, and they found that it fell from 35% in 2006 to 23% in 2016,
Oh
and
my.
then it fell to 9% in 2021.
Oh my goodness. Wow.
So in identifying that gap,
Yeah.
that's when I thought, I know what to teach. How can I do this on a massive level? And that's when I decided to create courses for nurses to fill in the gaps of what they forgot from school, never learned in school. And it really does play into patient safety, because if a nurse doesn't realize that respiratory rate is the most sensitive and earliest indicator of patient deterioration, they're not going to count it. And 80% don't.
Wow. Wow. And I'm just, as a 34-year RN here, I'm just like blown away by these numbers. And doesn't it make you wonder, why are these numbers not making headlines on every national newspaper, right? Why is this not all over the news? And because these are big issues.
Yeah.
These are
It's
huge issues.
Yeah, it's what I ask myself on a very frequent basis. In fact, that horrible midair collision that happened right in my backyard, because now I'm in right outside of DC,
Mhm.
killing 67 patients, people, not patients.
Yeah.
That is national headlines. And yet, when you
Mhm.
do the math, even conservatively, 500 patients die every single day in the US because of preventable medical harm.
Oh my God.
Again, because it happens one by one, you don't see the
Mhm.
totality of that number. And it is horrific.
Yeah, absolutely. Absolutely. And I think, there are so many system related issues to this problem, though, aren't there? Everything from, I know that nursing school curriculum today is greatly changed from what I went through, 34 years ago. I often talk about, gosh, when I gave my first IV push, started my first IV, my instructor was right by my side,
Yep,
and we did this on real people. It was a very different time. And I know though that nurses are not getting the same kind of experience that I got more than 30 years ago. And I think it's a real shame, because without practical clinical experience and the opportunity to do those things for the first time in a safe space, they're
right.
really missing out.
They are. And it's so fast paced too when they get hired. The first place that a lot of hospitals cut expenses is in the education department. So, do we have new grad programs or transitions to practice programs everywhere? No. Do we have
Right.
enough? I would say no, because every nurse needs one.
Hmm. Yeah, and I really think, it's interesting because I work in the world of continuing education, and continuing education typically has the definition it's above and beyond what nurses receive in nursing school
Yeah,
curriculum, right? Well, if they're not getting practical hands-on clinical experience, so then things like an IV skills lab become continuing education,
correct.
right?
Yeah,
And years ago, that would never have been the case. They would say that doesn't qualify. You get that in nursing school, but today you don't. You
right.
don't. And so we expect our nurses to be confident, and we expect, I think the new grads, we do expect them to be able to hit the floor and run. Um, and I'm hearing though that there's a lot of intimidation there too, that they
Yeah.
feel intimidated to ask for help.
Yeah.
And
They're scared.
yeah.
There's an article that came out not too long ago that basically said the top three fears of new grads are being able to keep up with the workload, fear of harming a patient. Just can't remember, just escaped me what the third one was. But yes, those are very real fears. And if we don't take them under our wings, and I know you talk about this, and we have to nurture them into the profession, we're leaving our patients to the mercy of chance when we don't onboard our new grads properly.
Mhm. Yeah, it's something. The world has changed so much, and sometimes when I hear about, well, and you know that even within our own family, we experienced something terrible. Just one of our family members went into surgery and there was an instrument left inside them, and they had to go back in for another surgery and just created terrible, terrible extended healing time, but also the potential was deadly.
Right. Yeah.
It was deadly. So,
And you're right earlier when you said people don't hear about these things, and they don't. So on the rare occasion that you see something like this on a TV show, for example, they think it's all Hollywood, but it's not.
no, it's not.
It's real.
Oh my goodness. So tell us about, a little bit more about the book, Surviving Your Hospital Stay.
I tried to include an overview of what a patient and their family would or should know when they go to the hospital. So I started out, I talk about communication in one of the chapters. I talk about how to pick your hospital. A lot of people don't know that you can go on hospitalsafetygrade.org and see, just put in your zip code. It's public knowledge. It's a nonprofit organization. And you could see if your hospital scores A, B, C, D, or F, just like your grades in high school or college, right? And you can go into the subcategories, and it's all patient safety related, and see how that hospital scored in each category. Are they red, yellow, green? And that will contribute to their overall safety score. But for example, if I were going for surgery and my physician said, well, I work at this hospital and this hospital, and my insurance covers it, I would for sure go in and look to see which is the safer of the hospitals. And then I would ask my surgeon, why do you work at a D-rated hospital? That means you're really close to flunking patient safety, and you can ask specifics. For example, there's a category that talks about blood clots after surgery, or respiratory distress or pneumonia after surgery. And you can say, well, what are you going to do to prevent me from getting a blood clot if I'm having surgery at this hospital? So
Nice.
really, the whole book is about empowering patients. We can't leave to chance and hope that we're one of the few that make it out without harm or die, which is really unfortunate. But I think we just need a revolution of how we expect safe healthcare. And by doing that, we need to become informed and educated.
Ooh, that's a mouthful right there, and I absolutely love it because it's so important. It's so important, and it's more than, just saying, because I'm in really small town America where I live, the rural Midwest, and it's kind of, if you're from this town, you should use all the resources and businesses in that town. So if there's a hospital there, no, this is your life, Um, and I've always said healthcare is a commodity. We buy it, we pay for it. We
Yep.
should get what we need from it. So yes, being an educated, informed consumer is so important. Wow. I love what you're doing with the book. So this is what you do for patients. Are there other ways that you serve your clients right now? How do you serve clients in your business and that kind of thing?
On my social media, which I was talked into doing TikTok by a coach, he said, your book is great, but it sits on the shelf in Amazon, and how do people know about it?
Mhm.
So I try to do almost every day. I think I've got over 200 TikToks now, that
Awesome.
then translates over to Facebook as well as Instagram for patients as consumers and their families. So I'll do a 2 or 3 minute little vignette about what's in the news, what's going on, how can you, if you find yourself in this situation. For example, I talked about a man who had the wrong knee replaced in surgery just last week. I talked about that one. And so as a consumer, what can you do? Um, they're supposed to mark the surgical site with the surgeon's initials. We know that only 60% of hospitals actually use the surgical safety checklist. So that's another question I would
Oh,
ask.
wow. Mm-hmm.
How are you going to make sure when I'm under anesthesia that you're operating on the wrong or the right body part, right?
Right.
Um, to prevent something like that. It's those kinds of things that just in bite-sized pieces can, tune in for a couple of minutes and say, Oh, I've never learned that, or I never knew that. The other one I did the other day was talking about a spinal epidural abscess that got misdiagnosed. Poor
Mm,
lady had back pain, couldn't walk. She got sent home. Came back in, bladder retention. I mean, urine retention, what,
yeah.
and by the time they finally did an MRI and saw the abscess, she went to surgery, but she's now quadriplegic. So
Oh my gosh.
the advice is don't go home, refuse until you get the test, the appropriate test. Nobody did a gait test on her to see how she walked. She said
Right.
she couldn't, but nobody assessed it. They didn't check her to see how much urine she had to retained until like the third time she came in with now a fever. And
Oh,
they found
goodness.
1,300 cc's in her bladder. So again, it's just the awareness piece of
Mm.
what do you need to know? What questions do you need to ask? And how do you ask it in a polite but persistent way?
Oh, I love it. I love it. Wow, such vital information. And I've often said though, when I've been in the hospital with one of my family members, that I don't know how people get through this without a medical professional in the family, who's going to be right there, because there's so much that's going on, and if you don't know what to ask, then things can go awry really, really quickly.
Yeah, that's another part of the book that I address is normal vital signs, because you as a family member can look at the monitor and say, wait, it's showing my mom's heart rate to be 110. That's too high.
Yeah,
And point it out to the nurse. And then 20 minutes later, now it's 115, or it still
yeah.
has come down to baseline or to normal. And that's where you as the family member can advocate and say, you need to check and find out why my mom's heart rate is too high. There's various reasons. It could be pain, it could be dehydration, it could be internal bleeding, various things, but it needs to be investigated. So that's again tips for
Yeah.
how do you learn what questions to ask is kind of go through the categories of vital signs and nutrition and hydration and post-operatively, those kinds of things.
Mhm. Wow, good stuff. I'm so proud of you for doing the work that you're doing. I just think it's such a, I mean, well, sadly, it's so needed,
Yeah,
um, and somebody needed to do it. So thank you for being the one.
you're welcome.
Yeah. So I'm going to shift gears a little bit and ask you if there's one thing that you enjoy most about working for yourself, what would that be?
You know, it's probably why I loved being a flight nurse too, the same reason. When I worked in the ICU and I had to call the physician and say, listen, Mrs. Jones, tachycardic, hypotensive, I think she needs a fluid bolus. Oh, I think she's okay. Call me back in an hour. You're like, why? You know, I'm here. It all
Yeah.
points to she needs some fluid. And so then when I worked on the helicopter, it was like I could use my judgment. I could use my training, my experience to say, here's how we're going to treat this patient's issue going on during this 30-minute flight or 45-minute flight. And my medical director always said, if you go outside of policy or protocol, then just tell me why, and we're okay if it makes sense. So as an entrepreneur, it's been exhilarating for me to identify a problem, take a solution and apply it to that problem, um, and have the autonomy to shift if I need to dig and to learn more and to grow my level of expertise in an area. I know in my heart this is what I'm supposed to be doing. My 45-year career has brought me to this is my mission, my calling. And I think as an entrepreneur, when you know in your heart where your passion lies, where your expertise lies, you don't have to take 45 years to get to be an expert on anything. But that's where your contribution can be, especially as an entrepreneur, because you can shape it to what you see your vision is the problem and the solution, and how you want to help humanity.
Oh, absolutely. I love that. And just there's so much wisdom wrapped up in that. So thank you for sharing. And I do agree that this is the space the world needs you in. Dr. Julie Siemers. This is where the world needs you. We need you right where you are. Um, one last question for you before we finish up here. You and I both know that there are nurses who aspire to be entrepreneurs and they're looking for something more out of life. They want more balance, more freedom, whatever. But they're maybe afraid to make the leap or they don't know the first step to take. What advice would you give? What one piece of advice would you share?
If you feel it in your heart, do it. Because there are so many resources. I have to say that, yes, different parts of my nursing career, there's a learning curve. When I first went to ICU, oh my gosh, the balloon pumps, the Swan-Ganz catheters, the, whatever, the pumps or whatever, all the medications. And then when you transfer to somewhere else and take that knowledge with you, you would now have another learning curve, whether it's I worked in the cath lab for a couple of years or, in each place you learn and grow. As an entrepreneur, it was a very steep learning curve, only because I knew nothing about how do I even set up an LLC? How do I find somebody that can help me like develop my courses? What platform do I use? And I've just learned every step of the way that people are willing to help you. This community, Teresa, that you have is amazing. And people want to help you. They want to help you succeed because I have this mentality of abundance. There isn't a shortage abundance for me, meaning or a scarcity. I don't believe that there's only a little bit of pie to go around. We each have a unique set of gifts, of experiences, of heart that will build what we see as a solution to help. And so, yeah, don't put it off, don't delay, don't put it on the back shelf or table it forever because you don't know how to get started or you don't know how to take the next step. There are people there that will happily help you, and I'll be one of them.
I love that. I love that. Yeah, just do it. And I think if your story doesn't just, exemplify that, it's the importance of take it what it is that you want to do, that you see in your vision and just get started because without somebody leading the charge for patient safety, right, to advocate and empower patients, where would we be? There's so many good things that are going on and so many good things that nurses can do that are only
Yes.
going to improve patient care and outcomes. And, with the trend of nurse entrepreneurship on the rise, what I see happening is that we're not only improving access to care, we are able to improve the quality of care that we're
Yes.
delivering and right along with that patient safety.
Yep.
So yeah, we're choosing to do it in different ways, but so much good stuff that we can do.
It is. It's like a tapestry. That's how I think to look at
Yeah.
it. You've got a red thread, I've got a blue thread, and we weave them together in this beautiful, sometimes you can't see what you're creating until after a bit of time and you step back and say, wow, that's beautiful, and I think
Yeah.
every one of us has a contribution to that beautiful tapestry of humanity, improving our healthcare.
Oh, I love that. I love that. And so before we finish up today, Dr. Siemers, I would love to give you the opportunity to share with our audience how can they connect with you beyond this interview. So if there's a website that you'd like to share or maybe where they can find your book or any free resources that you have, go ahead, the floor is yours.
Thank you.
Yeah.
Yes, my website, which is drjuliesiemers.com, Siemers. You can find, I've got blogs on there. I've got articles that I've written on there. I've got podcasts that I've been on. So whether it's on TikTok or Instagram or Facebook, and then LinkedIn as well. And I just try to disseminate as much information to help people as I can. My book is on Amazon, or you can get a link off my website there as well. And yeah, please reach out if you've got questions and comments. I love to engage with your audience.
Awesome. Wonderful. Well, thank you again for joining me today. It's been a pleasure to have you on the show. And for all of you who are watching and listening, I encourage you, pick up a copy of the book, Surviving Your Hospital Stay by Dr. Julie Siemers. You can find it on Amazon, as she said, or even on her website. But I think it would behoove all of us to give it a read and maybe share it with somebody we know. So again, thank you, Dr. Julie, for joining me today. It's been a pleasure.
Thank you.
You are most welcome. And to all of our viewers and listeners, thank you for tuning in. That concludes this episode. We'll see you next time on Dare to Do Nursing Differently. Bye for now.